please welcome Dr. Carolyn Chung. We're going to have a fireside conversation. Tell us a little bit about what you're doing in the role of AI at MD Anderson right now.
Sure. So it's true, AI is coming from all different directions, and I'm sure many of you using AI, some of you may be using AI whether you know it or not. It's embedded in our phones, it's embedded in various apps, it's embedded in websites, it's embedded in many of the email platforms that you may be leveraging. And my role at MD Anderson is to oversee all of data and AI. It's a small feat. So as you can imagine, we have a lot of data. We want to make sure we have a lot of sensitive data. We have a lot of data that we're stewarding for our patients and for the care. And so we want to make sure that we're responsible. We want to make sure that we're utilizing it in the best way possible so we advance cancer care, lead the new discoveries to actually help the next patient, but at the same time protect privacy and protect everyone's own data for their own purposes and make sure that we're doing that responsibly. And so that's one piece around the data. Obviously, AI does not run without data, so it's like the fuel for your vehicle. You can buy yourself a Ferrari or Porsche, I don't know what favorite luxury car that you may have in your head, but you can buy the best vehicle, but if you don't have the fuel, it doesn't run. And so similarly, AI is a tool. Some of these tools have become very powerful, and they can do a lot of amazing things. But if you don't put the right fuel in, it doesn't run so well. Similarly, you can have the best vehicle in the world, but if you don't know how to drive, you'll probably crash it into something, or you may not know how to get it started. I remember when I was first learning stick shift, I don't know if anyone knows how to drive stick shift anymore. Okay, I see hands going up.
A lot of people.
But it took practice, and so I think that similarly with AI, it is a technology. It's something that you need to learn to use responsibly. We don't want everyone going out into the roads without knowing the rules of the road, and you need to know that the red light means stop and the green light means go, although I guess in Houston sometimes you see people adjusting those rules a little bit. But I think that understanding those rules of the road and being able to be responsible with this technology, because especially as it gets more powerful, is a really important piece that we have to keep in mind. And that's something that we're really grounding ourselves at MD Anderson, making sure that if we're using technology like AI, and we're using it in the circumstances of clinical care, we want to make sure that each time we use it, we know that that AI model is actually working and doing what it's supposed to do.
Right.
And that the people using that technology are educated and informed so that you can actually utilize it in a responsible way and in a safe way. And so those are some of the things that we're definitely working on.
Is there something, like an example that you can give us that, like, where you've already started using it within the MD Anderson community?
Sure. I mean, when we think about AI in the healthcare space specifically, it really got born out of using it within radiological imaging. So using it for assessing mammograms or CT scans or MRIs, et cetera. We are utilizing some of these tools to help flag more serious cases, as well as help guide and filter when the work comes in. For instance, we're using a tool that would actually help discover blood clots in the lung. Obviously, that's a time-sensitive thing that we want to find very quickly, and so being able to have a tool that flags the cases that are suspicious allows us to be able to respond in a more timely manner. The other things that can, be okay to wait within the 12, 24-hour window, I'm sure all of us would agree we want the person who needs the care emergently to get flagged, and so these are the kinds of tools that we're actually leveraging.
Is there anything specific to, like, well, you said, like with breast cancer, is there anything specific that they've already kind of perfected or close to it that you can reveal? I know there's things you can't talk about, I'm sure, that are in the works, but.
Yeah, I mean, I think that in terms of perfected, it's actually really a difficult thing to say you can do.
Okay.
So you can advance a tool, but at the same time, remember I talked about the vehicle versus the fuel. The fuel constantly keeps changing because the imaging technologies, for instance, with mammograms, that technology is changing. So as it changes, a tool that worked one day with one type of imaging device, and your mammograms looked a certain way, and then when we went from films, which I'm sure many of you may
Used
have
to cart
seen
around.
cart around, to digital, and how those images were acquired digitally, that information changed completely. And so if you try to build a model that works on film and then you try to transition that over to a new kind of data, it may or may not work as well. And so this is where it's a constant.
It's evolving.
You want to keep evolving with the technology. Yes.
So we talked about the privacy aspect, and of course, it relies on human still. So should our ladies and everybody, the community in general, be concerned about their information being plugged into the AI that helps everything, you know what I mean?
You should be paying attention. Please pay attention. When you're actually, it's very tempting when you get a new app, someone's told you about this app that you really want to use, and then you get this scroll down and you want to just scroll past it so you can hit OK so you can get into the app. I'm sure all of us are guilty of doing this. But I would pay attention. The data use rules are changing. It's one of the things that I do. We actually, I partner very closely with our legal and compliance department. We do it up front so we protect the institution, all the data in the institution. We review those contracts with a fine-tooth comb to make sure that there aren't leaks, that the data has become an asset that everyone all the companies are recognizing, and they want to use and reuse that data. If you're using ChatGPT, I'm sure some of you are exploring ChatGPT.
I was on it this morning. Guilty.
You can ask it whatever questions you want. It is capturing your questions, so it'll start to track. Now, they could be completely benign questions and you really don't care, then that's entirely fine, but be informed. Whatever you cut and paste into that window, that's out there. So if you cut and paste your social security information, if you cut and paste your passport, whatever you're putting in there, if you've cut and paste your itinerary, that's going to get out there. So just be mindful of what you're actually putting into these systems and pay attention, because they are getting sneaky, and so we see a lot of it. The other piece around this is that when you actually do go into public forums and you give permissions to have your images and things taken and used, I think most of us are comfortable with having your true likeness be utilized to promote good causes. At the same time, there is language out there that says it can use your image in any way that they want, and a derivative of your image. And I'm sure many of you have seen the deep fakes.
Yes.
Where they can make a likeness like you say whatever,
so
and it looks so real.
Yeah. Or
and
using
so
your voice.
Yes, and so I think paying attention to some of this subtle language in your contracts, as well as when you're actually entering platforms or, whether it's social media or whatnot, is just being aware and being informed is an important step.
So we have women from around the country going to various, major cancer centers or, seeking assistance from major cancer centers. Would you say as a whole, the cancer community in terms of, cancer centers is really embracing AI, or was there initially a, like a hesitation?
I think it's an exciting technology, and everyone is trying to figure out where and how does it fit in. Because the thing is that it's a little bit of a toddler in the healthcare realm. I wouldn't say it's a toddler everywhere, but we're still trying to, we're toddlers trying to figure out exactly how it fits in. And the technology itself is also maturing. It's made leaps and bounds over a fairly short period of time. And so trying to figure out the right fit where it's still safe is something that everyone is working to figure out together. So I sit on a number of different organizations where healthcare organizations come together, and we're sharing notes and we're learning from each other. Yes, yeah. And we've actually built out a framework for what we call model management. So once you turn on something in the hospital, you have to know that it's going to continue to run. Now, when it's a device, like a piece of lab equipment or an imaging device, you do quality checks at intermittent times, and that's it's like tuning up your car. But when it comes to a model that's running, to constantly monitor it in the background is something that, it's an infrastructure that most hospitals don't have in existence today. So we've started to design out that framework and share it with other organizations, and we're working together to actually help people establish that. You know, MD Anderson, we're very fortunate. We have the resources and the team to come together to do this, but we want to also help the other hospitals to do the same, perhaps with less resources. And so if we can actually teach and bring them along, I think it's an important role for us.
Well, that's amazing. So I know that you spoke briefly about, you know, looking at AI to read, you know, different, you know, reports and so forth. How do you address error?
Yes, it's a good question. So this is something that we are still figuring out the human psychology of it all. So putting the technology aside, if you had, let's say, even an individual who is giving you assistance, and humans are fallible, they're not perfect, and so how do you know and what do you do to actually double check that that person is telling you true fact, and how do you know how often you're going to verify? And this is a piece that is difficult to tease out when it's AI giving you that result, because I would say that currently there are probably two camps. I'm hoping to create more people who are a little bit more balanced in the middle, but there are the enthusiasts who want to trust everything that it's spitting out, and then there are the skeptics who, even if it is right, really want to ignore it or double check it. There was actually a nurses study where they actually rolled out AI, and the nurses were actually not wanting to believe, and they trusted themselves over the algorithm. And that could be right in some cases and wrong in other cases. So how do you start to bring people along to find the balance of, this is another source of information, I'm going to look at it, but verify that it's actually trustable. Now, if you take that approach, the challenge there is that one of the motivations for bringing in technology like this is to decrease the load and decrease the amount of work. But if you're going to be so skeptical that you're double checking everything coming at you,
it defeats the purpose.
Are you actually achieving it? And so this is an operational piece that we're still trying to figure out.
So do you think that can impact like the workforce, the healthcare workforce ultimately?
Oh, for sure. And I think that there's going to be the systemic change that needs to happen. So with that model management, showing out the confidence of what the output is. If you got a response from a model and it's on your screen and it says, we're 90% confident this is true, we've tested the quality, et cetera, at least you have a gauge of how much you can put trust in it. And I think that's one step towards lowering the cognitive burden. The other piece is also educating up the workforce to understand the technology better. So we're actually building out a data and AI literacy program that we've been building for the last several years. And so upskilling everyone to be aware of what this technology and what the emerging tools look like. Yeah.
What about clinical trials? Do you think that AI will find its way in that area?
So AI is touching clinical trials in multiple ways. And so one piece is that it is very good at combing through and finding potential matches. Now, here, if it's not perfect, it's okay, because most people won't just blindly go into a clinical trial. They'll still read and do the consent. Sure. And so one way that AI has really been useful is actually trial matching. So someone can go online, look for any trials they may be eligible for, leveraging the features that the trials are looking for. You can actually find yourself a trial that suits you. And so that's a very powerful tool that I think there are multiple tools that are emerging. Now, which one is the best? I can't really say. We're still exploring.
Sure.
But I think that these tools are going to continue to help patients find the right trial for them. And the other thing is that these tools are getting better. And the other thing is that the trials themselves are getting designed by the data that's feeding in, so that you can actually design trials to help. If you say, based on this matching, we're completely missing 30% of the population over here.
And then it can help you identify those individuals.
Right, and we can design a trial to address those individuals.
But that's if the individuals have entered their information that would
Correct.
line up with them.
And so again, read your privacy contracts, but many of these have different rules. But at the same time, if you read through, there are ones that will say, all of this is private, this is really intended for you. And so I think this could be a really real benefit. The other piece is that we're actually using AI models in the trial design themselves to actually help design what cohort of patients should be put together. I think that if we look back 20 years in the history of breast cancer was just breast cancer. It was based on anatomy where the tumor showed up. And now we know there's many different kinds of breast cancer. And so once you start slicing down all the different groups, although we say breast cancer is the most common cancer, your particular subgroup could be very rare. And so this is where AI can actually help with designing trials that are suited for people who are most likely to succeed with a particular therapy that, we used to give one therapy to all kinds of breast cancer, and now we're learning that that's not the best strategy.
Right. So we have to talk about bias and health equity. How does that play into AI?
It's a tricky one. I think that the data that's out there is the data that's out there. Just like everything on ChatGPT is everything off the internet, the good and the bad. And so people are trying to be more thoughtful about the data that's going into some of these models. Not all AI models use all the data in the world. So, and just to clarify for those who may not be so familiar with AI is not ChatGPT. AI is much bigger than ChatGPT. Yes. So just to kill that myth. Yeah. So ChatGPT is not AI. It's not all of AI. And so I think that there are models that we're really being thoughtful about what data is going in to make sure that it's high quality data that we trust, that it's verified for health, if it's for health purposes, by health professionals, if it's for legal, with legal professionals. And we're also trying to think about how can we address the gaps in the data, because if the data is not in there, it's not going to serve that population. Right. Now, bias is not just the population representation. Something that I've been very mindful of is that even if that population is represented, if the care of that population has been biased up until this point in time, how do we actually not allow the AI to reinforce that bias, but to help how do we actually build this to start to help us mitigate that bias? I like that. And that's tricky.
I think I see a lot of heads nodding, so I think let's give a round of applause to that, because that's important, that's groundbreaking. Yeah. We're going to take some questions.
Can AI be used to enhance the current data that we have in reference to minorities, because we're still dealing with a big issue of a low number of minorities being involved in clinical trials?
I think that in terms of the trial matching piece, I'm hoping that it is an additional tool that you're not just relying on your local provider to help you match up the opportunities. So I think that is a way that it can open the door, that you yourself can take ownership and be able to have the autonomy to go and search out other opportunities across the country, to actually say, here is a trial, can I actually join this? And going with a very specific goal in mind and asking your provider, that could actually help open doors, and I'm hoping that will help alleviate. More importantly, I think in terms of, it's not necessarily AI, but digital tools, there is a big effort, and we at MD Anderson have been working on this as well, is trying to help bring trials to the communities as opposed to having everyone come to MD Anderson for the trials. So partnering and trying to give access through digital tools, digital ways of collecting data. And we're hoping that by removing that barrier of just traveling the distance and being in a different location, that would actually help alleviate some of those pieces. It's not the full puzzle, but at the same time we're working away at trying to bridge that gap. In terms of your second question was around, I'm forgetting what you said. Oh, yes. So part of the AI and the learning curve, and this is my opinion, and it's my personal opinion having seen what I have seen, I think that the AI that's been built until today, it seems to be that there was this feeling that if it wasn't confident in the answer it was giving, people would not buy into it. So why would you buy a tool that says, you know, I think this is the answer, but I'm not so sure? People would probably not use that tool. They would use the other tool that seems very confident. And so the way that the models, the end goal of the models that the data scientists have been developing in the commercial space up until this point has really been to help you feel good, right? So if you look at a lot of the AI chatbots, it'll give you a response. And one of the things that everyone talks about is how AI is so empathetic. Well, empathy, by definition, is being able to imagine and really feel what the other person is feeling, putting yourself in their shoes and conveying that compassion. That is, so when they say AI is empathetic, I'm like, that is not actually true. Like, that's actually impossible, right? So it can mimic empathy. It mimics empathy very well.
But it is not empathetic.
But it's not empathetic. And I will tell you a funny story that I was messaging with an Uber chatbot because my Uber account got messed up somehow. So, and it kept giving me this response of like, I am deeply sorry, I'm sure you're frustrated. And the 10th time that it sent me this message, I was like, this is not empathy. I'm like, I'm sorry, but it's saying all the right words, but it's driving me crazy. So this is the kind of thing that you start to witness. And so I think that, you know, trying to think about what that end goal is when you talk about training, one of the things that we've been focusing on is, in order for us to make a sound decision, whether you're a patient or family or care provider, is you need to know if this is the prediction or, you know, decision support recommendation or measurement that the AI is giving you, you need to know how confident, what is that error in that prediction? And then you can weigh as a human being, say, this is sort of the confidence that I have. You put it into the context of everything else, because we don't make cancer decisions just based on, is the tumor controlled or not? If the tumor's controlled, but you know, you're going to be laying in bed for the next 6 months, that may not be a choice that not all of us would make. Some of us would make that choice, and not everyone. Some people need to keep working through their treatment, and that is a reality. And so if that is the case, you're going to be weighing out all of these other things. And so to say you're going to have an AI model that's going to feed all of those complexities, all of the nuances of just you in and give an answer, I think we're a long, long, long way from that, because we don't have all that data going in. And so I think we just have to be thoughtful and realistic of what we're actually building out. And that's something that we've been really thinking through at MD Anderson, so that the models that we're building, we're thinking about, how does this actually get implemented? Who's going to use this? And is this really going to help the decision of the next step? I think when we first started talking about AI and equity, we thought the same model needed to do the same thing for everybody. But does that really make sense? No. So we've started to think about, when we thinking about equity, meaning if the end goal is to give you the best possible outcome, we do need to make the model be able to provide the best possible outcome. But that may not mean that each model is built to provide exactly the same output. There's a difference between generalizability, which gives you the best royal compromise across all groups, versus actually giving what's best for each group or even individual. The other piece of work that I do beyond AI is really building out a digital twin of you or someone else, and so trying to build something that's very unique to your own decisions. And so I think as you do, I would encourage you to engage and provide input. I think that we definitely engage, and we want to have input and engagement from all the stakeholders, whether it be the providers, the patients, as well as even, you know, we actually engage with administrators to make sure everyone understands, because these tools don't get purchased by one group or another, it's a collective. Right. And so getting everyone's buy-in and understanding is important. But at the same time, I think that this whole idea of generalizability is not necessarily reaching any of our end goal.
Right.
Good morning. Thank you, Dr. Chung, for being here. You have mentioned a couple of times about engaging a community. So what are the initiatives or programs that MD Anderson has implemented that we as a community can be involved in or sign up? I am a survivor, and I'm also a patient from MD Anderson. I am truly grateful and thankful because the staff over there is fabulous, but how can I help give back?
So we do have a patient and family advisory council that you can definitely get involved in. It is a group of volunteers who actually engage in and we pull them in depending on areas of interest as well as perspectives and expertise that you may be bringing within your day-to-day, and we engage with them to actually do things like, even with clinical trial design, we actually often invite one or several PFAC members to be part of that. When we submit grants, we actually approach the Patient Family Advisory Council. So we actually have an organized group where we actually have a way for you to actually connect in. You get put on the list, you can volunteer for things. They send out emails to actually let you know of opportunities. And so that's one way that you can definitely engage at MD Anderson.
Anybody else have a question? Right here.
Good morning, ladies.
Good morning.
My name is Tiffany. I'm from San Antonio. Dr. Chung, I have a question. Do you as a clinician have a vision or a personal win you hope AI will accomplish at some point in the future?
Gosh, I think there's so much you can actually do. One of the things that I would say is there's a lot to be said in terms of the frustration we have in just administrative coordination. I'm sure any of you who have tried to book an appointment finds this frustrating. At the same time, any of you who have been in clinic and due to the cascading effects of one clinic running late and then the next clinic, and then it's not the patient's fault, but they're coming in 3 hours late to your clinic because of everything else. I think there is a better way for us to track and make that more optimal. I think that clearly the hospitality industry has somehow figured out some of that. Perhaps not perfect either. I think we've all had our airline delays and everything else, but I think that trying to optimize some of those pieces, because these are burdens that are unnecessary, so we can really focus on the care. Similarly, with a lot of the paperwork that all of us are filling out, even as patient and family members, how do we actually bring that forward? And this is not necessarily just AI, but it's really how we actually manage our data so that we can actually make all of that more efficient. Now, the side of things that prohibit that from moving very quickly is the privacy and security pieces. But I think we're making progress on that side. And so if we can try to make some of those burdens more easy for people and less for people. I wrote an article on digital toxicity, for instance, just to bring awareness that the digital toxicity that we all experience within healthcare, both in the patient, how many times do you have to fill out the same information over and over again?
Yes.
So these are the kinds of things that I think are more straightforward in terms of what the algorithm will need to do. I think how we manage the security of the data is the piece that is really the hurdle.
Good morning.
Good morning.
As a clinician, do you think that AI or the new technology wave is dumbing down medicine? I know from going from Epic or going from paper charting into Epic, we kind of made smart phrases, made things to make it easy for us, but we didn't have to think as hard as clinicians now. So my take on it is, are we kind of not making medicine as impactful, or?
It's an excellent question. I think that it's the way that we have been utilizing technology, it's the approach that we've taken to utilizing technology that has started to decrease the amount of critical thought that we need to actually insert into our documentation. And we may still be thinking through it and we're making the decisions, but that documentation is not being conveyed. And so I think that there is a real opportunity, and I love that question because this is something I've been actually challenging, is that how do you actually teach that next generation the emerging generation to really critically think this through. And so one of the things that we've done is we've created the Institute for Data Science was with this spirit, is how do we actually create like-minded computer scientists and data scientists who are building these models, speaking with the clinical providers to understand what is that secret sauce that we have that allows us to say, we walk into a room and you say, this person's not doing well. Yes, you could make a checklist of 10 things, but is it just those 10 things? And so how do you bring that into the medical record? And how do you actually force the next generation to learn to document that critical thinking, because it will help them grow. I think there is a gap that is starting to get created, and so this is something that has been top of mind for me, is that while we are building out a data and AI literacy course, we've also been looking at the human AI interaction to say, we can't start losing our clinical skills in replacement of data and AI literacy skills.
That's a big concern.
It is, yes.
Yeah.
And that has to do with understanding human psychology, understanding how we actually remember and consolidate information. There was an interesting study in the New England Journal that got published fairly recently around gastroenterologists who were doing colonoscopy, and they had introduced an AI tool to assist them in the colonoscopy. These were seasoned gastroenterologists, but within weeks, not years, they started to lose their skills to actually, because they are getting reliant on this tool. Wow. Now, I don't think they truly lost their skills. I think they lost their attention because they were starting to rely. And so this is psychology. It's not, so I think, but imagine the next generation of people, they would have never even learned those skills.
So it goes away. Wow.
So
you're looking at how to mitigate that.
And so one of the things that I've started to do is I was starting to reach out to the airline industries to say, how do you keep your pilots trained to overcome autopilot? When do you know that you're supposed to overcome? Because they've been using this for a very long time. The number of incidences of plane events have statistically, I know you watch the news and you may think otherwise, but statistically have gone down substantially since the use of these tools. And we should be learning from other fields. And so learning from other fields is something that we've definitely focused on. Yes.
Question about the consultant aspect, the impact of AI on that piece, from doctor to doctor, field to field. So from oncologist to primary care to gynecologists and the like, the impact of that across those genres. And then the secondary portion of that, the impact of AI on the concierge care for a patient.
So I think I understand the consultant. I'm not entirely sure what you mean by the consultant interaction.
Across, for us as women and us as patients, a lot of times the doctors don't communicate with each other. So your primary care doctor is supposed to act as the quarterback, which doesn't always happen. Is there a way to integrate AI to help with that from doctor to doctor, or is there a scope in which that is evolving that you can see or would be helpful or impactful in that area?
Again, I mean, I think that the bigger piece around this is the data connection, as opposed to, could AI be part of that solution? Possibly, but even if we could get the data connected seamlessly, it would actually open up lots of information that probably isn't currently siloed. And so that's why, there are some organizations that have a chief AI officer independent of the chief data officer, but now you've created two silos. I think the fortunate thing is that MD Anderson has been supportive to have me oversee the two sides that we can actually, and it shouldn't be two sides, those are completely married together, to think about it holistically so that we can actually solve one problem that also alleviates the other problem. Mm-hmm. In terms of the concierge piece, one of the things that I think I would there's a promise, but I would also caution against, and always trust but verify, take that trust but verify approach, is that there are a lot of questions that I'm sure that are tempting, especially at 2 in the morning if you can't sleep and you want an answer, that you're going to look online, and I'm sure, and see lots of
We're all
nodding
guilty
heads.
of it.
We're all guilty of it. And I think that when you do that, just make sure that you do go and get it verified with a health professional, just so that you don't want to be going down a path that is misinformed. So.
This has been very, very informative, and I'm so proud that Sisters Network was one of the first Black-led organizations to have someone of your caliber here talking to us about groundbreaking artificial intelligence and just data protection. So if you could just in 1 minute sum up what these ladies need to do in terms of, I know, being protective of their data, but just some parting words.
Sure. I will share that I also I chair a nonprofit organization called Women in Cancer, All in Cancer. The website is womenincancer.com, and so you can go and look it up. And we are actually having an upcoming webinar series on AI and oncology.
Oh,
so if you're
wonderful.
wanting to learn more, please join us and sign up. It's womenincancer.com. I think that you're doing all of the right steps in terms of wanting to learn more. I think that we all need to get familiar with this technology. Like I said, if we think about if AI is the most powerful, fastest car out there, but it's not self-driving, although some people would try to convince you that it is, that we all need to be responsible. We all need to get educated. We have to understand the rules of the road so that we can all safely operate and not hurt ourselves or each other in the process. And so I think getting informed, pay attention to what data rights you are giving up or volunteering when you're actually doing it. So do it consciously. And so I think that whether you're using an AI tool or allowing your data to be used, do it in an informed way, because that's the power that you have. And so you have that autonomy to do so. And so I would really encourage that. And I'm happy to take additional questions in the coffee break. So
Okay.
thank you very much.
Thank you, Dr. Chung. We appreciate it.